This week on Health Across the Islands, drug-resistant bacteria identified in St. Vincent and the Grenadines Hospital. More deaths from leptospirosis in the Dominican Republic. Devastating earthquake in Colombia. Unhealthy air quality due to Saharan dust across parts of the Caribbean. Ghanaian nurses joined the healthcare workforce in St. Kitts and Nevis. All this when we return on this week's episode of Health Across the Islands. Thank you for joining us on Health Across the Islands, your Caribbean weekly health news briefing. I'm your presenter, Natasha Robinson. The St. Vincent and the Grenadines Ministry of Health is monitoring a drug-resistant bacterium detected at its general hospital, the Milton Cato Memorial Hospital. The ministry identified 4 patients with wounds carrying carbapenem-resistant Acinetobacter baumannii, also known as CRAB, through routine laboratory testing and antimicrobial resistance surveillance. The bacteria were found to have the NDM resistance mechanism, which is associated with resistance to several antibiotics. This makes it difficult to treat because some commonly used antibiotics may no longer be effective. Acinetobacter baumannii can cause serious infections, particularly among people who are already ill or who are receiving care in healthcare facilities. The ministry says it is actively monitoring the situation and has implemented infection prevention and control measures to identify and manage potential transmission within the healthcare setting. At this point, there is not a widespread outbreak in the community. The situation highlights the growing problem of antimicrobial resistance, which occurs when bacteria and other microorganisms change over time and no longer respond effectively to medicines. For this reason, people are being reminded that antibiotics should only be used when prescribed and be taken exactly as directed. 19 people have died from leptospirosis so far this year in the Dominican Republic, as the country continues to experience a resurgence of the disease. The latest surveillance data available from July 19 had recorded 207 confirmed cases and 16 deaths, already representing a significant increase compared with the same period last year. Residents are still being reminded to avoid contact with floodwater when possible, cover cuts and wounds, practice good hygiene, and take steps to control rodents around their homes and community. They're also being advised to share information about symptoms of fever, headache, muscle aches, chills, vomiting, and diarrhea, which may be due to possible exposure to water or soil contaminated with the urine of infected animals, particularly rodents. A Category 7.4 earthquake struck west-northwest Colombia on August 10, causing significant damage, deaths, and injuries. As the country continues its emergency response, the Pan American Health Organization PAHO and the World Health Organization WHO are providing technical cooperation to support Colombia's health authorities. This in light of damage to 303 health facilities and major road networks and disruptions to water, sanitation, and electricity supply, leaving many displaced residents. Meanwhile, countries including Antigua and Barbuda and the Turks and Caicos Islands have been monitoring their residents who were on treatment abroad programs in Colombia. We will continue to monitor this crisis and will highlight any developments in subsequent newscasts. Saharan dust is once again affecting parts of the Caribbean, with air quality reaching unhealthy levels in Antigua and Barbuda, and elevated levels also being reported across parts of the Lesser Antilles, including Guadeloupe. In Antigua and Barbuda, the latest dust event represents the country's 22nd Saharan dust surge of 2026, with air quality reaching levels considered unhealthy. The dust contains tiny particles that can irritate the eyes, nose, and the respiratory system. For some people, exposure can result in coughing, throat irritation, difficulty breathing, and worsening of existing respiratory symptoms. The most vulnerable people include people with asthma and other respiratory conditions, people with cardiovascular disease, children, and older adults. During periods of poor air quality, people in these groups should limit prolonged or strenuous outdoor activity. If you use prescribed medication for a respiratory condition, make sure if you're in any of these areas you do have it available and follow your healthcare provider's instructions. And your final story this week, St. Kitts and Nevis has welcomed 47 nurses from Ghana as the country works to strengthen its healthcare workforce. These nurses were formally welcomed on August 10 under the Ghana Labour Exchange Program. The group includes 32 general nurses, and 15 community and public health nurses who will work across hospitals and clinics in St. Kitts and Nevis. The nurses are expected to help ease long-standing staffing pressure and expand the country's capacity to provide healthcare services. Healthcare worker shortages remain a challenge across the Caribbean, with countries competing internationally for nurses and other healthcare professionals. These were your stories making up your latest episode of Health Across the Islands. See you next week.